how can we make the future of global health knowledge more accessible. So we have, I'm very excited. So our second guest is also here. Great. Great. So let's start with Joy. Are you okay? Where is your mic? You are there. So, Joy, let's get started with you. I introduced you by saying you have a long career and experience in global health and public health in various countries, and your own country, obviously, originally. How would you were comparing, if you were to compare the global health knowledge in the past and how it was, let's say, early in your career, and how you think it is now changed, and what kind of things you've observed over time?
Well, first of all, I want to apologize for coming late. I came from the airport, rushed to take a shower before coming here, so I do apologize. When I first started working in the health sector, I was working as an auditor for local authorities, that is, auditing the primary healthcare system, doing both financial and management audits. And everything was recorded, by hand. All the health data was captured, by hand. We had a huge, folders where we had to record everything. We had efficient primary healthcare workers, that is community health workers, who used to have a file for every household, and they would have a section in the file for every member of the household. So everything was written by hand. And the global health, the World Health Organization guidelines, everything was printed. Mm-hmm. And it was very, very easy to know what you need to do because you only had one source of information. That was the World Health Organization. You didn't have to search to find out, which source is right and which one is wrong. You just took the World Health Organization as a source, and that was it. Mm. So that was the situation when I started working in healthcare.
And what you've observed in the last few years?
In the last few years now, there are so many sources of information, and it's very, very confusing. And there are so many centers of excellence around the world that share information, and they are not aligned. So you get different data from different sources, and then of course you have the rogue scientists and the rogue medical practitioners who spread disinformation. But there's also misinformation, which is a little bit more innocent but can do as much damage. But right now the situation is very, very complicated. It's difficult to know where the right source of information is, and also the way we capture data, because we are mixing digitalization and manual data capturing. Data gets lost. So we are now in a situation, I feel, that is much worse than when I first started working in healthcare.
Interesting. And Monica, from your experience, a lot of your career was to work with people who were homeless or unhoused in the city of Boston, for example, or other populations you worked with. What were the main barriers to information in the past, and what was your experience?
Yes, thanks so much. Wonderful to be here with you today and talk about this really important topic with Joy here. Joy, you raised some of the issues that were really at the system and healthcare level. And I want to go down to a patient level and just talk for a few minutes, because we're here to talk about healthcare information, right? And how that directly relates to health outcomes and in the system level. So I'm going to go to a couple of patients of mine to kind of illustrate a couple of points. So in my tenure as Chief Medical Officer at Boston Healthcare for the Homeless, I took care of patients who firsthand, I became a firsthand witness to seeing how it was that they had trouble obtaining health information and how they had trouble turning that health information into a health outcome and how that led to health disparities. So I saw I took care of patients who lived under bridges with diabetes and had to think about how to store their insulin without a refrigerator access, and how to keep their sugars from fluctuating without having regular meals. I took care of individuals who couldn't wash their wounds, so then they had limb loss due to preventable wound infections. I had one gentleman I took care of, a 72-year-old man, who, to earn money, would shovel snow in the brutal winters of Boston. If you come visit us, please come during the summer months and the autumn months. And he would shovel snow wearing shoes that weren't waterproof. And when I took care of him, he unfortunately had frostbite, which due to cold elements, if you're staying outside and wet, is a common thing that we see, not all too uncommon. And he had multiple surgeries and in the end lost several of his toes. And when I was talking to him about this, he gave me this knowing smile when he said, there really was no other way. There was no other way. And what that really highlights for me is our basic hierarchy of needs. So as humans, we need to have these basic things filled: water, safe food, place to sleep, et cetera, in order to then address things like non-acute preventable health issues or chronic disease issues. And I raise that because as we think about health information in the massive amounts we have now and what we had then, for people to be able to obtain this information, it has to be easily accessible. So for that patient that I described to you, how can he find out easily where a health clinic is? How can a patient during a pandemic know where to get a vaccine? Or what the current social distancing guidelines are. And all of this raises this concept that we talk about, I'm alluding to the social determinants of health, which these patients of mine had, and those impact health outcomes. And yet, information is also a determinant of health. So when we think about information as a determinant of health, then these factors come in of what kind of, at the individual and the patient level, what is the infrastructure they have to get information? In the days that you're talking about when we were on paper, right? It was teams going out, word of mouth. Now, do our individuals who need our services the most have the infrastructure they need? The phones, the internet access, the computer access, right? And is our system able to take these vast amount of information that you're talking about in our current system to be able to help that individual? And last thought on this is, when you think about this patient that I'm describing, individuals who are in marginalized situations get care in multiple different places. Their records are part paper, they're part at one center, part at another. And so this disjointed system of care is also contributing to the inability of us then to have the health information we need to help them.
Mm-hmm. Does that resonate with you, Joy, in terms of your experience in Botswana and some of the populations and on the continent, maybe?
Yeah, absolutely. Because I think what she's saying is that, in relation to us on the African continent, the continent is diverse, as you know. There are urban, there are rural, peri-urban, and systems are different. But one common factor is that now there is a lot of information available out there. And the question is, which information should be used by the communities? If you go to the rural and even some of the peri-urban areas, you'll find that people listen a lot to the traditional leaders, they listen to the religious leaders, and they have, those are the sort of what we now call influencers, who may not be medical experts.
Some of them might be right here with us.
Yes, they may not be medical experts, but they understand. They understand how to communicate with their people, and the people listen to them. So I think the challenge for us now, as health people, or health experts, the health sector, is that we should impart the right information to these religious leaders, to these traditional leaders, and even perhaps to the influencers, the social influencers, because over 60% of our population cohort is young in Africa, and they are influenced not by WHO and us, the old fogies, but they are influenced by
What they see.
what they see, and
Yeah.
the influencers are the ones who influence them. So maybe these are the people whom we should bring on board and target with the right type of information, so that they can impart the right information to their communities.
So if we were to unpack a little bit the misinformation part, we had in season 4 physician scientist Peter Hotez dialogue, where he really painted a picture how he was fighting misinformation about vaccinations in US, but also globally. And then he was really exposed, and he's including like personal threats to him, trying to kind of provide the up-to-date information, etc. How do we really fight with that? But also, what has been, for example, Joy, from your experience, what has been the impact on health of the community? And what does the community do to fight against that kind of misinformation?
You see, the sad thing about both misinformation and disinformation is that it's always mixed with a little bit of truth. It's always mixed with a little bit of truth, so it misleads. So and the little bit of truth that is always there is little bits of truth, particularly on nutrition. Like you'll remember during HIV/AIDS, people were saying, well, there are certain foods that you can eat that will combat HIV/AIDS, beetroots, and that has got multiple nutrients. And of course, if you eat those foods, you feel a little bit better. So you because it's mixed with a little bit of truth, then you start believing that actually it is the real truth. But what it does is that it kills people. People who were not vaccinated during COVID died. And we see children who have not had their measles vaccines dying, children who are not sleeping under mosquito nets on the African continent die. So it's that is the effect. But because the misinformers or the disinformation bearers always have an agenda of demonizing, the traditional healthcare system. Yeah. So when they die, the traditional healthcare system will be blamed. A mother will be experiencing labor. She'll go to somebody who does not understand that she's having obstructed labor. They'll try and push the baby out, do all kind of weird things. Then when the baby is really in distress and the mother's in distress, that's when they go to the hospital and the baby dies. The hospital has killed the baby. It is not the person that they took to first. They took the mother to first. So that is the problem with this misinformation and disinformation. Unfortunately, the way it is communicated, it is reinforced by the way by the health sector.
I know you're working with the African leaders around malaria. Is this something on the agenda of the leaders and how they might be pushing back or at least working in this area? Is this something on their agenda?
Well, what we try to do is to use data to inform decision making and to inform plans and to identify bottlenecks in the health system and resolve them. So, and real-time data that is properly collected, that is as accurate as possible. Mm-hmm. So that is the approach that we adopt. And then we also use the guidelines that have been developed by WHO, so that and no other ones, so that there is a more adherence, to standard medical practice. So that is what we try to do, rather than try to fight the misinformation and disinformation,
Okay.
but try to ensure that the right information is used, sort of coach people so that people can start using the right type of information and using data in the right way. But our biggest challenge, of course, is the quality of data and the accuracy of the data. So that is one thing that we need to focus on. And that is, I think, the huge advantage that digitalization has brought and the introduction of AI. Because if we combine, effective collection of data with the use of AI, we can actually come up with systems that will enable us to analyze, use data more accurately, and therefore do make much more progress in fighting this misinformation and disinformation than we would otherwise.
I hear you. Monica, you brought all of that great experience you had before to Google, and now you're working. And what does Google do in this area to kind of fight the misinformation? And what are the plans or what is happening right now?
Yeah, thank you. I want to pick up on this point that Joy raised because whenever we hear at the community level, in a patient clinic, at other levels, these pieces of misinformation, right? What is the way to address those as a society? It's to flood the systems with high quality information, right? So as much high quality as information as we can get out there that's reachable by as many as possible is a real shared goal. And so I just want to take a few minutes to go through some of how that works. Mm-hmm. So first of all, just to think about the perspective, we're talking about health information here. So when you look at YouTube as an example, there are 200 billion searches on YouTube that are health queries. So people are coming to YouTube. People are coming to search, to put in the search bar at Google search. They're asking health queries. So 3 out of 4 individuals in the US starts their journey, their health journey, with putting it into search. So this point that you're raising, Joy, about the high quality of the information is really important, and we're actively working to uphold this information quality, and I just want to explain that a little bit to you. Before that, some of the ways, when you think about people coming to these tools, right, you mentioned we have to have the tools and the places to come. When we think about people coming to use these tools, there's misinformation, which is the pieces that you were speaking about, Joy. I was just reading about miracle mineral solution for malaria, and we're interested in your area of work. So there's things that are dangerous and can kill you if you lose them. That essentially becomes bleach when you ingest it. That's misinformation. And then there is misinformed. So I could be misinformed if I'm trying to understand something about a diagnosis that I might have, and I don't have all of the information that I have in order to make informed decisions about myself. So I just want to make that distinction because both happen, and misinformed, when you think about how people search for information versus misinformation, it has an impact. So let's talk about YouTube. I mentioned all of these views on YouTube. So YouTube is a tool where people are coming for the health information, and we want to make sure that we're amplifying trusted voices on YouTube. So if you go in, so let's be concrete, if I put in and I search for chest pain or diabetes, the first thing that, when I'll see is prominently displayed health sources, right? And those health sources are based on high quality information. So what I mean by that is those health sources are individuals who are either licensed healthcare professionals or health information experts. And the process that they go through, there's a vetting process to be part of that health source information. And so the healthcare professionals, for example, have to show proof of license. And what this does is it gives individuals a place to go to say, this is information that is high quality, that has been vetted, where I can go to hear about chest pain or whatever else it is that I need to learn about. So that's one thing to highlight. And the second thing, by the way, we're talking about data and health sources. Another thing that you can find on YouTube, which I find helpful, which gets at this question you're raising about, or the issue that you brought up around trusted voices in communities. Similar to the health sources, there is a place where you can go for personal journeys. And if you go to that section, say I was just diagnosed with depression, you can go there and hear from others who are diagnosed with depression, who can give information on coping skills, makes people feel less alone, and that's another source for people to go for this high quality information. Now, when you go over to the search side, right, so people may, just like they put in chest pain in a YouTube search, they can do the same in Google search and look up chest pain. So when people are doing these health queries, I told you how many of them, remember that the search mechanism is basically taking the World Wide Web, and instead of us each individually having to, dive deep into the World Wide Web, it's giving us an index and a listing, right, of information that may be useful based on what we are looking for. And that is based on, how that is ranked is based on a ranking system that was built with decades of expertise, and the quality metrics upon which those are based are available, for anybody to look at. And they're really based on these things of, is it expertise, experience, authoritative source, and trusted, right? And that's how those show up as health overviews. I want to also mention that when someone is in crisis, so if they're coming looking for something related to suicide, domestic violence, or sexual assault, that actually will trigger a hotline and a crisis intervention, so that by location, someone will get information about local resources. And just want to add to this, because there's a new, we're talking about new developments, and so a relatively new feature is AI overviews, right? So you were mentioning, Joy, about AI and generative AI and how this is all changing this. So the way I like to think about AI overviews is that you're going beyond getting these links and getting more of a direct answer. It's interesting because I said people put in chest pain, but actually when people search, they usually put in a lot more information than that, because we all feel very personal about our health and what exactly we're looking at. So what AI overviews does is it gives you a summary with more of a direct answer, but the links are still there using that same ranking order. And just to give you an example, I talked about chest pain. If I instead put in, I am a 65-year-old male who ate a hamburger last night and I'm having chest pain. I'm not a 65-year-old male and I don't eat hamburgers. But if I put that in, it's very interesting, because first, just like when I put it in regular search in the AI overviews, it first appropriately says, I do this in the US, go 911, so get emergency care. But then in the reasoning behind why to go get emergency care, it gives all the reasons and links to those. So it's really helping me better make a decision based on this information. And if I put in I'm a 65-year-old male and I'm a medical doctor, then it gives me the same thing, go to the emergency room, but it changes the terminology and uses medical terminology and goes to my appropriate health literacy level. When you were introducing the topic, you were talking about, health literacy at different levels and different languages. So this makes it in a way that I can then grasp that information, right? This high quality information in a more appropriate, personalized way.
One more question, and maybe our audience is not aware, but this disinformation inoculation thing that you guys are doing, what is that?
Again, when we talk about information, right? So we really want to distinguish between high quality information and low quality information. And by doing this process where we go through and we really pay attention to, is this authoritative information? Is it from a trusted source, right? And can we find, is it someone with experience? And by ranking those, that really then allows to put enough information out into the system. Again, it's flooding the system with high quality information so that people have that and can make decisions based on that.
Did you want to?
Yeah, I just wanted to I think that approach is very good. But I think in order for us to actually, what can I say, make it more useful to our communities, yes, I would like a system like that to be endorsed by WHO. Normally, I would have said the US CDC. Now I'm beginning to get worried when children are told not to vaccinate for measles. But to be endorsed by medical authorities, a group of medical authorities around the world, so that it can be a go-to place for information. I once suggested this actually when I was at the World Bank, working at the World Bank, because we used to have finance data, which was just people, ministries of finance were getting finance data, economic data from everywhere. And I had said that, okay, they should choose maybe one data source like Wikipedia or something and say this one has been endorsed by the World Bank. So, and then they make sure that that vetting process that you talked about, they participate in that vetting process. But they shut that down. I mean, but I think in the health sector, this needs to be done because you will still get some of these rogue scientists finding their way in there. And, I think what is happening with the US CDC, the US people will forgive me who are here, is a case in point. So they will always find a way to come in. So I think you need to really authenticate, for lack of a better word, that vetting system in some way.
Yeah, and I wanted to say, I forgot to mention, so thank you for reminding me. When I was talking about the high quality information and the information, the standards and guidelines that are used in order to say what is high information, that takes into account the National Academy of Medicine, the World Health Organization, and other organizations. So this is done based on existing guidelines for what is high quality and also, who is providing high quality information. So I wanted to mention that. But I do think, you're getting to a point of, we have multiple levers that we can pull depending on where we are and what are those that we can pull. And when we know that a source of information people are coming to is they're searching the internet, they're looking for answers, this is one lever to say, this is high quality information. And then there needs to be education saying, how are you going to then engage with this kind of health literacy, which I think, to your points, should start at a young age. How are you going to engage with this information? How are you looking up something? Are you asking the right questions? Are you getting back what you need? And how do you understand the sources that those come from? So I think it's an excellent point.
Absolutely. And I think another way is for you, the private sector, those who own the media and also the private sector who are investing in health, to actually promote the use of information. And one way that they could do it is helping countries, to actually properly digitalize the surveillance, collect effective surveillance data, accurate surveillance data, and even do because surveillance data is very, very important for demand forecasting, for the supply chain. So if you have ineffective collection of health data, you are not going to be able to do proper demand forecasting. And we know that in the private sector, they're using blockchain, they're using AI, for all of this. So why not bring this? Because I think if we develop confidence in the use of data and information within the public sector, within the population, then people will start relying more and more on reliable sources of information that have been vetted like you, because they will see the evidence of the benefit of doing so. Because right now, I think the benefit is not as evident as it could be.
Monica, you already mentioned that in sort of how generative AI is used and some of those summaries, etc. And you had a commentary in Health Affairs not that long ago about the promise of this generative AI in public health. So both in terms of making the information more equitable, more accessible, and culturally specific, all of that. And of course, Joy touched on that in terms of how that can be then used. And do you think the governments see or governments are looking into the use of this potentially? And have they been kind of in touch with you or discussing how this can be used? Can you shed a bit of light into that?
Yes, I thought maybe you and Joy met without me, because she basically started to answer the question, this question. So Joy, I want to address that because actually that's the crux of the work that we do in Global Health is to really help infuse AI and generative AI throughout to help with these issues related to disease surveillance, disease prevention, nowcasting, forecasting. So your question gets right into that. First, to talk about the health affairs framework. As various industries move forward with, we've all seen the rapid adoption of AI and generative AI, right, in the last couple of years. And one of the things that, for me personally, I want to make sure is as public health, we don't fall behind in that. Right? So, Joy, you were alluding to this too. We need to be able to use these tools in a safe and reliable way in order to advance health. And if we don't do that, we're going to have further widening of the health disparities. So hence the motivation to write this piece in Health Affairs that my colleagues and I wrote, and it's a framework for how public health can get started. Because part of it is getting started, getting comfortable, seeing what is produced that can actually improve health. And so we did that in 3 buckets. It's a framework that's in 3 buckets: communication, organizational impact, and then advanced data analytics, which is what you're asking about for it. So first, the simplest one is to think about how we communicate. And health information, right, we've talked about it at the individual level, at the healthcare level, at the systems level, but it's all about how we, if we're going to try and flood the system, as we said, with high impact information, we have to have the trusted voices, be able to have accurate, easy to understand, approachable information. So right now, when I was running the Department of Public Health in Massachusetts, we had a small communications group. They would take a white paper or a scientific paper. They would take the time to turn it into a brief to give to the governor to make a decision about where resources to go. They would make something to go on social media, right? They would put something on our website. Something would become a letter to a legislative partner, and so on. And that was very labor intensive. Now, with the tools that we have now, you can simply feed that into a tool like Notebook LM and ask the system to create the social media, create the letter to the governor, create the web post. And it does that and produces it within minutes, what used to take myself or my staff, sometimes weeks to get done. And then that is something that the communication staff can actually then put their own voice into it. And that's really them working at the top of their license, so to speak, where they're using their time and energy to think strategically about how to get these messages into the community. And I give you that as an example because there are these ways in which we can use these tools now to help what we're trying to do now with our public health messaging and our trust and improving high quality information. And the most important thing to mention what I keep in mind when I do that is that this is as if I had an intern with superpowers next to me, right? So it 10x is my capacity, but just like with an intern, I would never send something out that the intern wrote, right, without reviewing it and putting my own voice and expertise into it. It's the same thing, right? These are things that can help us as a tool with always having a human in the loop, as we say.
Mm-hmm. Joy, are countries you work with, you think, ready to harness this kind of tools and sort of make use of them to get the information or fight misinformation? How are things going in that in the countries that you work with?
I think countries are ready. I think there's just hesitancy because people think that these things will be expensive and they'll be difficult to do. And that is where the hesitancy is. We have been working with Smart Africa. Smart Africa is the digitalization partnership on the African continent, and developed a partnership called the Partnership for Digital Access in Africa, PDAA. And with PDAA, what we are trying to do is harness what Smart Africa is doing and get the governments and the civil society, the private sector involved in actually digitalizing health. And I think we have invited you to the partnership as well. But I think by doing that, you are turning digitalization into a friend of global health, not into a tool, an effective tool. Sort of just like the way we are communicating it is that it's like medicine. If you have found a vaccine for a very communicable disease, you'll want to adopt to use that vaccine and to make sure that every single citizen in your country gets that vaccine. So this is exactly how we are selling digitalization and access to AI, and the impact that it can have on global health. That it is just as effective as using as vaccine, but only if it is used in the right way, of course.
So just to
Yes.
piggyback on that, you bring up this excellent point around public-private partnerships. So, my time as a public health professional, especially during the pandemic, we saw that healthcare systems, government systems alone didn't have the answer. So we have to get creative in our field about public-private partnerships. So one of the things I'm really excited about is our work that we're doing with global partners, mostly governments actually, and the ministers of health, as well as NGOs, to look at how can we help that next step. And you talked about, resources. The Notebook LM one I mentioned is a free resource to be used. There's the Open Health Stack is for developers to be able to advance their work within the country. And we're also working with countries directly to say, the point that you're raising, you want to be able to bring your information together in a powerful way that takes structured information, unstructured information, and starts to be able to use these advanced analytical tools to answer these questions. And one model I want to mention is the Population Dynamics Foundation model. And that's a model that we've developed. And it's a novel geospatial foundational model, and it's really designed to unlock complex relationships between populations, their outcomes, and their environment. And it takes lots of different sources of information that otherwise would be really hard to bring together.
In fact, I'm very excited about that tool because
Excellent.
I saw it, and because what I thought was missing in health is sort of the link, when you're talking about climate change, the linkage between the climate change data that we are collecting and the health data
Yes.
and the environment.
Yes.
And it will also be very useful for One Health.
Yes.
Yeah, so I really
Yes.
found it extremely stimulating, and I think it is one thing that you can easily sell as a tool for all of government, all of private sector, like you are saying. It is absolutely brilliant, and I think it's exactly
It looks
what
like
is
Joy
needed.
and I have to do some follow-up after.
Definitely.
But
Yeah.
the way I think about that model, by the way, in case it's helpful, is it's like a fingerprint of a community, right? It has these environmental, population, facility information. You can
Exactly.
take that, and if you have existing models and you're trying to, do forecasting
Yeah.
or nowcasting, or you want to understand where to put the resources, where will they be most useful, how do you measure impact, it can add to that. And I must say, every day in global public health, we're doing that. We're making decisions about where to put the resources. And I wish that we had better information upon which to make those decisions.
Absolutely.
In a way, the podcast Global Health Matters also the idea was to break the silos and have different way of communicating global health, because it's really become very siloed in the recent years, and that's what we hear from our audiences. They come and learn things that otherwise they will not learn in other places from people who are guests or who are trailblazers here and there, and really that's where they get that cross information, not just from one field or the other, but the cross-cutting kind of approach to things. Lastly, to wrap up, to both of you, to kind of look into the future, and if you could write a message to your grandchildren, to our future generations about the global health knowledge, what would that message say? Whoever wants to go first.
We are writing a message to the future.
Yeah. We won't be there, but they will
Okay,
be
I would start by saying we messed up. But we have actually developed tools that will be absolutely invaluable for you. And we hope that you have actually built upon these tools and used them to improve humanity. Because I think digitalization and and AI are a huge opportunity for us. We can reduce poverty, we can reduce ill health, we can reduce, poor education, we can improve the quality of our education. It is a huge opportunity. We can bring the disenfranchised into the fold. So, but we have to harness this in the right way and make it available to everybody.
Okay.
And that is the challenge.
That's your message. And Monica, what's your message?
Beautiful. The world is changing so rapidly. You asked for a message for the future. I'm actually going to give a message for this crowd right here, for us here today. So we can close the gap in health equity and bring in those disenfranchised individuals. We can do that by focusing on justice and fairness in health. We can employ data-driven precision public health approaches with community-driven voice. Knowledge can flow freely, and knowledge can flow freely, focused on equity and integrity. We can get people the right information at the right time, at the right level that they can digest it. And we can do this now. It is achievable, and if we work together across sectors, this is something that we can do.
Great, thank you. So now I'm gonna see if people in the room have questions. So there are already few. So we'll start maybe this way, and every question gets a tote bag. So who wants to go first? Yeah, okay, go first. Here, maybe, yeah, and then you, and then we'll go around here.
Okay, thank you very much. I am Margaret Mana from Sierra Leone. I work for the Ministry of Health. Thank you very much for so much insightful information. Thinking that paper-based is confusing. As a front line, we have so many paper-based that is so burden to us, filling those paper-based and also providing services. Additionally, for AI and technology, we are living in a community where internet access is still impossible, making these things impossible to our rural communities. How can the two of you give me like a takeaway that can help me to provide services that you said are patient-centered, quality, integrity, in a humane way that provides equity and equality? Thank you very much.
That is a very important question, which is it is in response to that question that we are forming this partnership, the Partnership for Digital Access in Africa. This is to try to accelerate the access, like you are saying, to the internet, but also access to the tools that you need as well. And we are working with Google, we are working with Skylink, we are working with all the partners that are working in this particular space. But you are quite right, and we are working with the government. That is really, and the private sector, that is really what we need, that needs to be done. And that is why I'm saying we have an opportunity, and people tend to think that it will be expensive to do. But in actual fact, the benefit of doing this is much, much higher, 10 times, sometimes in some economies even 20 times higher than the cost of actually investing in digitalization.
And just to add one sentence to that, I would say that, at the individual level, there are solutions available. There's ways to use those tools offline now, where you don't have connectivity. And the other thing I want to highlight that Joy is mentioning, a lot of the issues you're raising are systemic barriers, right, and systemic issues. So we have to look at the system then and put in system solutions. So working at that government level, doing the public-private partnerships. And one of the reasons I mentioned this Population Dynamic Foundation tool, one of the reasons it can be potentially helpful is it can fill in gaps of information where you don't have it in areas such as rural areas where there's less information. So there's opportunity there. Thank you for your question.
Great. Next question, please.
Yeah, so it's also a question for the lady from Google. You stressed a lot actually that you flood the system with high quality information. But for the moment, I think as most of us experience, we're being flooded with lots of different kind of information on a number of platforms. And from that angle, I'm actually wondering how exactly do you approach, for example, the MAGA fan? So I assume that flooding this person, with high quality information doesn't really work. So do you have data on this? Do you segment your approach? How does this work? Because I can imagine that even if you flood them with all kinds of CDC information from a few years ago, this is not going to work for them.
Yes, Christoph, is it? Yes, lady from Google's Monica. Nice to meet you. You bring up an excellent point, which is around, and maybe I'll make sure I say this clearly enough. The high quality information flooding the system is the system that we can. That's why I specifically spoke about search and YouTube. And the flooding of the system is also to work towards saying the information that is in the system, can we rank so that the highest quality information that is from trusted sources are first? The point that you're raising is as a bigger society, right? There's many different aspects of where people get their information, both from a technology point of view and from a systems level and from our community levels where the work has to be done. You're right, putting in a search for something and getting an answer is not going to change any hearts and minds. And that's why for me, the technology piece is a counterpart to a lot of other work that happens in this area.
Okay. Next, you have a question? Yeah, go ahead.
Thank you very much, Monica and Joy. It's a pleasure to be here. My name is Abiola. I'm a nurse and also a health informaticist, and I run a company called MyCura in Nigeria. Interestingly, we actually got grants from Google to help with our AI segment of what we do. Now, we've been in operation for over 4 years, right, trying to improve home health in Nigeria. However, the data we have gotten before now has been very good in making predictive predilection for our community that we are helping. But the challenge, again, like what she said, is all about getting it to the community level. And even though we've managed to find a way to do this, it's still much about how do we then intelligently use, our data to actually meet the problems at the community level. Thank you.
Okay, thank you. Whoever wants to quickly answer, then I'll take one and from each side, so to be equally distributed around here. And sorry, those of you behind me, I don't even see you.
Yeah, I just wanted to say that what we have been trying to do, working with from community level, health facility level, from the health centers upwards, is identify smart indicators that need to be collected in order for you to monitor the health impact and in order for you to assess progress. And if you focus on those smart indicators and collect them effectively, because you cannot collect everything, and you are just inundated by data if you are going to collect all the data that is required, then you could even use smartphones to be able to record and to track. And we develop very, very simple applications that are interoperable with your health management information system. Now, the challenge, why am I excited about the tool that they've developed, is that we can use this tool to make those apps in your smartphone interoperable with the Ministry of Environment, the data systems there, data systems in the Ministry of Agriculture, and in your environmental scientists data that is collected for monitoring weather systems. So there is something that is happening now, and we are working in Nigeria, and I think we can follow up with you after this meeting.
Great. One more there.
Hi, I'm Priti Patnaik from Geneva Health Files. I'm a journalist reporting on global health. There are very strong commercial incentives that is actually fueling disinformation. Should public authorities be cautious about who they partner with in order to fight disinformation, particularly in the health space?
I would say yes, yes, yes. underscore that. Yes, absolutely. Because rogue scientists have led us astray so many times. Sometimes they say work with medical doctors, yet you work with medical doctors who deliberately give you the disinformation, not even misinformation, disinformation, which is deliberate. So I would say yes, please be careful whom you work with.
Okay.
Thanks, Gary, and thanks, Monica from Google, and thanks, Joy, for this inspiring, informative session. It's maybe a statement, Gary, it's just a closing statement.
Okay.
Not a question anymore, I think. So my name is Matthias Bonk. I'm the professor for global health at the Akron University here in Berlin and chairman of the Berlin Institute of Global Health, a small think tank. And I'm getting approached by a lot of people from the general public as well, asking me, what is global health? And who are the global health actors? And my answer is always, we all are global health actors. What we eat, what we drink, what we wear for clothes, and what mode of transport we use, everything has to do something with the health of another person. And we here in the rich north or richer countries, we build our wealth on the health of other people in poorer countries, to be honest. In the globalization, I mean, I don't have to give more examples. So maybe we as the global health community need to address the general public a bit more about the connectivity between what they do in their daily lives and what impact it has on the health of others near and far. And that might be the inspiring, hopefully, a statement at the end to say, isn't that what we all could do a little bit more in our global health ivory tower to not only address patients and medicine and health information distribution, but also talk to everyone around us on what impact they have with their daily routines on the health of others somewhere else. Thank you.
Thank you for that. So with this last statement and all the great questions, I'm going to thank Monica and Joy for being such a great live recording guests, and also for all of you who came to this experiment that we're having. So thanks for coming. And we are starting season 5 as of 14th of October with an episode coming out that the whole season is going to look at the future of global health. And the first 2 guests are Abril Campos from Mexico and Catherine Chiotopungi from Kenya. And we will be having that for the next 12 months as a focus of the podcast. So don't forget to tune in, subscribe, and all of those other things I need to tell you. You already know. Thank you very much.